And Matt, it comes as health leaders in our state say they're leading the charge nationally in investigating these rare cases of heart inflammation in vaccinated teens and young adults.
This grabbed all of our attention, Jamie. Today we learned from the Department of Health here in Washington, they have received reports of vaccinated teenagers and young adults experiencing heart problems. The CDC is now sending investigators here to Washington to help the state look into these cases. The heart issues have been mostly mild, and officials do not know if they're actually linked to the shots. But here is what the CDC is now investigating: whether the vaccine is causing the conditions of myocarditis and pericarditis. So myocarditis is a mild inflammation of the heart muscle. Pericarditis is the inflammation of the sac-like tissue surrounding the heart. The conditions are typically caused by a virus.
We had several patients from Washington that were identified with myocarditis that had received the vaccine. So we were very aggressive in talking to the provider community, the public health community, to say, hey, look, if you've got any of these cases, we want to hear about these so we could go through the details and work out whether this is associated with the vaccine or not.
Once again, just to be totally clear, health officials here in this state and at the federal level do not know if the shot is causing the heart inflammation. They are not seeing a big spike in these heart inflammation cases, and 60% of the people in this state, as Jamie just reported, 16 and older, have received at least one dose. Now, with that said, they want parents and young adults out there to be looking out for the symptoms. So let's pull them up here on the screen. Those include chest pain, difficulty breathing, severe headache, blurry vision, and new abdominal or leg pain. Still, pediatricians and experts say COVID-19 poses a greater threat to most kids and young adults than mild heart inflammation that can be easily treated with medication.
We know that there is a real threat with COVID in children. Most people think that it's fairly asymptomatic in children, but we have, since last mid-May, when the CDC started tracking, we've had over 3,700 cases of severe illness called multi-system inflammatory syndrome in children, and 35 deaths, known deaths from that condition that are associated with COVID infection, not vaccinations.
So those health experts say the key for kids to return to school and other activities is getting them vaccinated when they become available. And where you live in our state has a huge impact on whether the people around you are actually vaccinated. So the state updated us today. They said one of our counties on the low end only has 28% of the people in the county receiving one dose. On the high end, it's 77%. That's one county. Now, looking at our most populated county, Snohomish County right now, 60%. King County right now, 73%. But look down here at Pierce County. They're still down at 43% of their population, adults, getting one dose. Hey, we know that you have questions about this, and we really want to help you get some more answers. So here's what we're going to do, and we're excited about it, because coming up, we're going to talk one-on-one live with the president of the Washington chapter of American Academy of Pediatrics and ask questions about what parents need to know when it comes to this vaccine in light of this new information.